Strategic messaging means that you are deciding what to say and when to say it. You are laying out the vernacular and the focus of the debate around medical cannabis. The average person has a very superficial understanding about medical cannabis. They're not thinking about all the nuances that your community is thinking about. The more unified we are in our messages, the more likely we're gonna get the media and elected officials to focus on the topics we want them to. The more people, no matter what walk of life or what age, ethnicity, having them say the same message over and over again, but from their perspective, shows that there is a consensus about how we move forward in medical marijuana. The first step in creating a strategic message is to know your audience. A lot of times, activists spend way too much of their time trying to convince the 20% to agree with us instead of focusing on getting the 80% to be active with us. Craft your messages so they're reaching out to people that you know already agree with you and you know are more likely to act. Medical cannabis supporters, people who have already come out with positive statements, so you're conveying to them a message that they already support, but now there's more for them to do. Put out messages that focus on the parallels between medical cannabis and other patient advocacy organizations. Within medical cannabis, there's an array of levels of support. While 80% of the nation does support this issue, the truth is about 2% have actually done something active or have really done something beyond supporting it in conversation with their friends or when a pollster calls. The issues of medical cannabis can be broken down in lots of different perspectives, but it's important for you, as you're talking to the media and elected officials, to know how you want them to view this issue. And the way that we frame our issue can be as simple as vernacular. Use terms that are more healthcare oriented. It's going to sound more natural for someone who is a healthcare advocate. Those of us who are involved in this movement represent a minority. And so what we have to do through the framing of our message is try to include as many people as possible in that message, to try to get as many people to self-identify with our movement, even if they're not directly using medical cannabis themselves. Our opponents love to try to reframe this issue. When we first started Americans for Safe Access, their line was simple: marijuana has no accepted value. We heard that message over and over again until advocates started moving the conversation of medical cannabis away from simple law enforcement encounters and started having debates in public about how we get this medicine to patients. So our opponents could no longer use simple messages. Now what we hear from our opponents is that smoked marijuana has no accepted value, or that it shows some possibilities, but we really need to put this through FDA. Those are the messages of our opponents. And so it's important when we're framing our issues not to fall into a trap of responding to our opposition, using their terminology, having a debate where they want to direct us. Instead, when you frame your message, you're setting the tone for debate. And the last part of strategic messaging is often the hardest for medical cannabis advocates. As you're developing your key messages, you have to share them with others. While getting behind one message may seem like a daunting task for medical cannabis activists, there are actually some very simple tools you can use before a press conference or before a hearing at your state legislature. Print up talking points. Have them ready. Obviously, people don't need to read the same points, but they personalize them, and it's an easy way to get everyone speaking on the same messages. Creating messages. The way that you're going to go through this process is you're going to first identify the problems. The city is banning dispensaries. The city is creating zoning restrictions. So just articulate what the problem is. Then articulate what the solution is, followed by what action people can take to help make that solution. And then once you have those 3 points on, then you can start creating your key messages, or what you may call talking points.